Regarding the percentage of asymptomatic, yes, correctly stated at 90% as of today, and about 10% of our people get mild, moderate, and critical disease. And this could be attributed to our demographic profile, because if you look at the profile of the African population, we have close to 60 to 65% of the population being young people under the age of 25 years, and therefore they tend to get a mild form of the disease. Looking at the statistics for today, we have 44 people in ICU, and 22 out of the 44 are on ventilator support, and 22 others are on supplemental oxygen treatment. This tells you that, therefore, it is imperative that we develop strategies to ensure that we can be able to manage some of these people at home. Based on the WHO criteria of home-based care, we, together with our case management team, customize the protocols from WHO to suit our local environment. And now we are managing quite a number of people at home because majority of our people are still asymptomatic, based on agreed criteria that has to be met and be verified by the healthcare workers. And also because majority of our people are asymptomatic, that has accounted also for a low mortality rate in our population, which as of today stands at about 1.9% compared to the global average of 6.7%. So going forward, we are going to put more emphasis on home-based care. That is why I've developed those guidelines and even translated them into Kiswahili. And we appeal to other counties to be able to develop abridged versions of the home-based care protocols in local dialect so that the people can be able to own them, because responsibility for management of COVID disease going forward rests with the individual. And it's also imperative that we look at the cost of management of asymptomatic to the very critically ill. The cost of management of somebody who tests positive for COVID, who is basically asymptomatic per day, is about 21,300 Kenya shillings. If you have a mild form of the disease with mild symptoms, maybe a mild cough or just slight difficulty in breathing, then that puts you at 21,400 shillings per day. If you have a severe form of COVID, in which case you require supplemental oxygen, that figure jumps to 51,000 shillings per day. And if you require ICU critical care support, including intubation and ventilator support, the figure goes to 71,000 per day. So looking at these economics, then it makes business sense to be able to put measures in place to ensure that we practice home-based care, especially that a big proportion of our population get a mild form of the disease. And we pray going forward as the disease evolves that the same scenario obtains.